We have a health alert to notify you about. If you have visited or come in contact with anyone from the San Diego Psychiatric Hospital on Rosecrans Street near Old Town, you may have been exposed to an infectious disease. Someone at the hospital was diagnosed with hepatitis A. Staff and patients and visitors who were at the hospital between April 5th and April 25th may have been infected. Signs and symptoms of hepatitis A include fever, loss of appetite, nausea, vomiting, diarrhea, or pain in the upper right abdomen. If you feel you've been exposed, please go to the hospital for help immediately. Vaccination, whatever they can do to help you. Okay, this is a hot topic, especially because standardized testing is coming out next week, in the next couple weeks. If you're a parent or want to be a parent, you want to listen to this. How can you help your kids make the grade without causing too much stress on them? You know, we've got Dr. Keith Cantor, an expert with children and the behavior of children, and you always have great advice.
Taylor, this is dealing with anxiety, and when kids get too anxious or adults get too anxious, performance goes down. And you want a little bit of anxiety going into test situations because that does kind of get you through it. But if you go over that level, it's counterproductive. But managing stress with kids is how we do it with adults. It's well balanced. Kids who do the best, kids who really do the best in school are like parents who do the best at work. They take care of themselves.
They go to bed, they get enough sleep,
they
eat healthy.
Healthy diet. It's really important. We have so many studies indicating that if you don't get certain nutrients in your diet every single day, we can link those with certain psychiatric symptoms. Okay, so healthy diet.
And sleep is really important.
Sleep too. Teenagers really tend to eat really poorly unless their parents feed them. And a lot of times they want to eat out because they don't want to be with their parents. So getting a good nutrition for their kids is important. Sleep is very important. Organizational skills is probably the #1 thing. See, in schools they don't really teach kids how to study and how to organize, but the ones who do really, really well and have the less anxiety are the most organized. Okay?
I gotta tell you something though. My kids have all of that from day one of life, right? They know organizational skills. They eat very healthy, and they get sleep. I have a 10-year-old.
They get exercise.
Type A.
Exercise?
Oh yeah.
All right, just check.
Okay, so type A personality, stresses out about everything. Gets straight A. Kid does great on tests, but stresses like crazy. I said, why are you so stressed out? You study all the time. You get good grades. And she goes, because I got it from you.
Well, I was going to say that.
That's really important to be a good example.
That was my last tip. Is the parent's attitude is very, very important.
They mirror your behavior.
Oh yeah, kids identify, internalize, and model their parents. If you get anxious about stuff, they're going to get anxious. If they get anxious and you get calm, it calms them down. I say to parents, look, if you're in a fight with your child, just go the opposite direction. Start to whisper. They calm down.
They mirror their parents.
If you're confident, they pick up on that. And the parent attitude is very important, Taylor. It really is. If you have that and you're Taylor, do the best you can, you push them to do the best they can, and you follow the things that we're talking about, you're going to have a successful kid.
Well, I'm so driven, overachiever that
really?
That did trickle down on my poor daughter, and so she's too driven. I'm like, bring it back down. Then I have my 8-year-old who the teacher said, and I don't know what your advice is for this, she's like joy in a bottle, always joyful. I don't think she ever gets stressed unless she's taking a test. And so her test scores don't reflect her abilities in class or her homework. She gets so anxious, her brain just kind of freezes.
So that's taking it too far. So she's getting too anxious, which means that the idea
during the test time.
Which means that she's got test anxiety, which means that you have to go back and ask her and work on why she's so anxious, because she's going over the edge. At that point, a lot of it's expectation. If they have too high of expectations or they worry about letting their parents down, they get so anxious they can't think. But if you're working with them, doing the best you can, being supportive, doing the things that we talk about, getting sleep, and really encouraging that, guess what's going to happen? She will calm down as you calm down.
And you know, teachers are great. Having a parent-teacher conference or asking for another meeting, as I talked to the teacher. And by the way, that teacher said she hates standardized tests because it's not a real true reflection of a lot of children's abilities.
It's true.
Like for me, I'm dyslexic, and growing up, I mean, people probably thought I was a big old dummy.
Is it?
I hope nobody else thinks that. But
Never. But no, these are standardized tests. It's more about ability versus achievement. It doesn't tap into other areas of intelligence that kids have. So it's very, very important. But with test anxiety, it's really important for kids that your attitude with them, doing the best you can, trying to work with them to find out why they're putting so much pressure on themselves, and then working in some of the areas that I mentioned really does help.
And then if it really is something, maybe your child has some learning disability.
Could be.
It could be dyslexia. Like
Yeah.
I have severe dyslexia and wasn't diagnosed till I was a young adult.
Okay.
And
It was late diagnosis.
Yeah. So my years in school were painful, but maybe it's other things. You know, if your
Sure.
child can't focus, you know, there's so many tools out there to help.
There is, and you want to look what the symptoms are that are going on, and then do your homework and try to figure that out. Trying to help them understand it themselves too. Very, very important. So with that, really you've got to work together with your kids, in every aspect, especially on grades and calming down too. And getting really anxious during a test, here's the tip. You can't be anxious and relaxed at the same time. So the number one thing we need to teach our kids how to do when they get
sure
anxious.
about that?
Try. You want to do it? We can do some deep breathing. If you breathe deeply, we always say that to kids when they take tests. Lots of studies have showed this. If you go into a test situation or you're going for a job interview and you can get yourself calmed down by taking slow, deep breaths, it triggers your brain to relax. You can't be anxious and relaxed at the same time. You want to try it?
Okay, let's try one.
Take 5 deep breaths. Slow. 2. You feel better?
Yeah, if I
So you're
wasn't
only on
anxious
2,
anyhow.
but you're only on 2.
I love being on here. This is the one thing that doesn't make me
it works.
anxious.
I tell people, look,
Yeah.
stop 5 times a day.
Yeah.
Take 5 really deep breaths, and just stay present.
Yeah.
If you do that,
be present. Teach your children that. It's a huge
That's
thing.
it. Staying present is another one that's really important. If you stay present, you don't go forward, you don't go backwards. You're on task.
And you can't get you won't get
And
the
you get
anxiety.
anxious. You won't get or depressed. If you go backwards, you get depressed.
I know that. If everybody just knew these tips, thank you
That's why we're here.
for bringing
We're
them
here.
to
That's why
our
we're here.
viewers
That's why we're here
and
with
to
UT.
me.
Yeah.
Thank you, Keith.
Anytime, Taylor.
We're going to take a quick break. We'll be right back.